10 TDH News. I'm your host Tyler Hendricks, and today our top story we'll be talking about the new disorder that is sweeping all across mid-Michigan. For more, here is Dr. Hendricks with the latest information about Tourette syndrome. Hi, I'm Dr. Hendricks, and today I will be explaining Tourette syndrome. So, Dr. Hendricks, will you tell us what Tourette's is? Tourette syndrome is a nerve disorder that causes one to have repetitive, stereotyped, involuntary movement and vocalizations called tics. Tourette's usually is a lifelong disorder and can affect you in many ways. Wow, that sounds pretty serious. So, will you tell us what the causes are? There is no cause for Tourette's. Researchers say that the most likely cause of Tourette's would be an irregularity in the brain, like the frontal lobes and the cortex, or the circuits that connects these regions, and also the neurotransmitters, like dopamine or serotonin, are responsible for the communication among these nerve cells. Tourette's has been shown to be passed on in a generation. There is also a dominance in the inheritance of Tourette's. Males are 3 to 4 times more likely to have Tourette's than women. Are there any particular symptoms we should be looking for? Symptoms usually start when the individual is younger. It can affect any race or background, and Tourette's can either be simple or complex. Simple tics are sudden, brief, and repetitive movements that are involved in limited muscle groups. Some examples of simple tics are eye blinking or other eye movements, facial movements, shoulder shrugging, and head or shoulder jerking. Likewise, some examples of vocal tics include coughing, grunting, sniffling, or even barking. On the other hand, complex tics can include facial movements combined with a head twist or shoulder shrug. Others can seem like they are done on purpose, like touching objects, twisting, bending, or even jumping. The most dramatic tics can include self-harm, like punching yourself in the face, or vocal tics. And yes, there is actually a Tourette's where people swear or scream inappropriate words. This is called coprolalia. Only a small group, around 10 to 15%, are affected by this, and there's also echolalia, which is when someone was to repeat the words they were to hear. Tics can be triggered by physical experiences, such as a tight collar can activate a neck twitch, or if one were to hear another one clear their throat, that would cause them to clear their throat also. So what type of techniques are used to treat this disorder, and what is the prognosis? Since tics most likely do not cause any problems, the majority with Tourette's do not need any medication. There is medicine for those who need it because their tics interfere with their function. Neuropleutics, which are drugs used to treat psychotic disorders, are used most to suppress their tic disorder. There is no medication that is helpful to all people suffering from Tourette's, nor does any medication fully cease their symptoms. In addition, medications have side effects. Some side effects of neuropleutics are weight gain and sedation. Since there is no cure for Tourette's, the condition in many individuals repress as they grow older. In return, some may become symptom-free or no longer need any medication for tics. People with Tourette's have a normal life expectancy, and it does not impair intelligence. Thank you, Dr. Hendricks. For more, feel free to visit his website at www.drhendricksknowsall.org. Thank you.